Hello dear viewers, a good day to all of you. This is Dr. BK for you, who is going to discuss about the introduction to anatomy in this lecture. Now first of all, I would like to clearly define the objectives for this lecture is so that at the end of the lecture you should be able to understand first the definition of anatomy, followed by the various subdivisions of anatomy, normal anatomical position, various planes of the body, then terms of relations, and various movements of the bodies. So we would like to see one by one, which is actually listed here. Now first, coming to the definition, what is anatomy? So what do you mean by anatomy? And you all know very well that once when we talk about anatomy, immediately what comes to our mind is the dissection or the dissection classes which we encounter in our first MBBS course. Now ana means apart and tom or tomy means cut and the cutting process. The process of actually cutting and seeing is actually called as anatomy, and the same meaning also applies to the dissection. So dissection means, you all know that section means cutting. So dis is apart and sectioning process. So the process of cutting apart is actually called as dissection. So that is why it is aptly to tell that anatomy and dissection go together. They cannot be separated because there is no anatomy without dissection. Now before going into some basics of the anatomy, just let us try to understand how our human body is made up of. So here it has been clearly demarcated that we start from the molecular level. If we start from simple molecules, so basically these molecules are again made of certain atoms, and these molecules, what happens is they try to form certain chemical compounds, or again we can call them as molecules such as protein molecules, fat molecules, carbohydrate molecules, minerals and vitamins. Now these molecules, especially we all know that protein molecules are very indispensable because they are responsible for the various functions of the cell. They synthesize so many hormones or enzymes and all those things. What happens is, next to these, these molecules, they all form the constituents of the cell. So cell and its organelles mainly consist of these molecules. Now slowly, if you see that the cells or group of cells, when actually together they form a tissue. So a tissue is actually a collection of cells, and a group of tissues, what happens is they form organs, and many organs join to form an organ system, and many organ systems put together they form an organism. So from simple to complex, this is how our human body is actually built, and a pictorial representation on the right side. So that is what has been depicted here, with one usually from molecules to the heart cells, that is the muscle fibers of the heart, and slowly how do they form the tissues with the syncytium of the heart, and how the heart organ is formed, and the circulatory system, like that various systems. What happens is they join to form a whole organism, that is our human. Now broadly, to study anatomy, it is called as gross anatomy. Now why do we call it as gross anatomy is because we appreciate the structures in our body grossly. That is when we see through our naked eye, that is actually called as gross anatomy. Now this gross anatomy can be broadly classified into regional anatomy, and other one is the systemic anatomy. Now regional anatomy is which considers that organization of the human body into segments or major parts. So here you are able to see thorax is a region, abdomen is a region, cervix or cervical region, neck region, head region, back region, gluteal region, popliteal region. So like that various regions. Now this is one way of reading gross anatomy, that is called as regional anatomy, where we approach region by region. The next method by which we can actually understand or read anatomy is actually called as systemic anatomy. What happens in the systemic anatomy is it recognizes the organization of the body into organs or collective apparatus that work together. And of course, you all know what is systemic anatomy. You would have come across all these things. So various systems. Naturally, your integumentary system, which is mainly the skin and its appendages, which deals with the skin and its appendages. Then you have the skeletal system, which deals with your bones. Of course, muscular system, nervous system, endocrine system, cardiovascular system, and of course some other systems which are also not shown here is the excretory system, reproductive system, and so on. Okay, so either we can approach by through system wise the anatomy or region wise. The other subdivisions of anatomy apart from the gross anatomy, as I told you in the beginning itself, we appreciate anatomy through the naked eyes. There are also other subdivisions of anatomy like microscopic anatomy. So this, you need to study this anatomy with the help of a microscope. So you take a small piece of tissue, what we call it as tissue. So tissues, the other name is histose, or that is why this branch of anatomy is actually called as histology. It is actually called as histology. You prepare the tissue, there is various process we have to follow, and finally what happens is after processing the tissue, you look under the microscope, then you will be able to appreciate certain structures which will not be visible to the naked eye, but in the microscope you can come across this. Now here, for example, what you see in this picture is actually the microscopic anatomy of the liver. So all these small things what you see here is the liver cells. Then it is divided into many lobes, and of course there are some veins which are called as sinusoids and all those things. I don't want to go into those details in the introductory class itself. I just want to tell you that if you want to appreciate certain structures in depth, then naturally what happens is there is one branch of anatomy which deals with it, and this is actually called as microscopic anatomy. The next, of course, a very interesting branch of anatomy is embryology or developmental anatomy. So that deals with the development of the humans right from the zygote to the embryo to a full developed fetus. So the various processes and the various stages involved, how the various organs and organ systems are developed, how actually they resemble a human form at the end, and this is actually called as the embryology. Then of course one more interesting aspect of anatomy is the surface anatomy. What you are able to see here is you will be able to appreciate the structures within our body in the surface itself. So for that, as an example, I have actually projected this picture for you. So in this you can appreciate the sternum, and this outline of this muscle you are able to see very well, which is a pectoralis muscle. Actually for this, naturally you should have a very well built person, then only you will be able to appreciate these muscles. Then the xiphoid process, jugular notch, of course the deltoid muscle, all those things you will be able to appreciate in surface anatomy. On the surface you will be able to appreciate some bony landmarks, not only bony landmarks, some arteries, veins also you can see on the surface. Naturally you can feel the radial pulse. To measure BP, naturally you should actually able to locate some arteries. More commonly located artery is the brachial artery, which is actually used for recording the blood pressure. Okay, so that is surface anatomy. The next, a very important branch of anatomy is the cross-sectional anatomy. Now this cross-sectional anatomy, why it is so important is because the knowledge of this anatomy helps you to diagnose various diseases, especially through non-invasive procedures. So all the non-invasive procedures, especially nowadays what is used called as CT or computerized tomography, or MRI, magnetic resonance imaging, of course then positron emission tomography, and so on, we can keep on saying. But for that, what happens is you should have a sound knowledge of this cross-sectional anatomy. So at a section given at any level, you should be able to appreciate the structures, and also you should be able to differentiate the normal from the abnormal. Okay. So here, for the sake of illustration, I have given a section at the level of 10th thoracic vertebra. So what all structures you can encounter? Of course, here you are able to see on the right side the large structure. What you see is the liver, and for you this is actually the stomach, and of course the spleen you are able to see here, and this is the vertebral canal with the spinal cord inside, and all these are muscles of the body wall, anterior abdominal wall and posterior back muscles. You will be able to see that. So only if you are very much thorough with this normal anatomy at a cross-sectional level, then you will be able to identify what is abnormal. So cross-sectional anatomy plays a very significant role in diagnosis. Of course, we all know, we would have come across these pictures in our lifetime at least once in a while, what we call it as a X-ray or something. This X-ray is a term which is used only by a layman. The correct term is actually called as the radiograph. Okay, so we call this as a radiograph. So radiographic anatomy means which mainly use radio waves. So here you are able to see a plain radiograph. This is mainly responsible. You can appreciate bones, and especially to find out any fractures or whether the development of the bone or the healing process of bone is normal. That is one thing. Then of course it is not only about radiographs through plain radiographs or X-rays. Nowadays what we have called as the ultrasonogram. Then of course I have already mentioned you about the computerized tomography and other MRI images. So with the help of MRI images and computerized tomography, you would be also able to appreciate the soft tissues, whereas in a normal plain radiographs you will be able to appreciate only the bones. So this branch of anatomy mainly deals with the radiographic anatomy, of course. So we have seen about radiographic anatomy, microscopic anatomy, developmental anatomy, surface anatomy, and so on. But ultimately our knowledge of anatomy we should apply while actually diagnosing or during the treatment. So applying your anatomy knowledge in the disease process or in diagnostic outcomes, or to actually to treat the patient or to perform certain procedures where your anatomy knowledge comes into act, and that is actually called as clinical anatomy. Okay, now for example here you are able to see something called as thoracocentesis or thoracentesis, where the pleural fluid has to be aspirated. So when you have to aspirate the pleural fluid, naturally what happens is, if you are going to insert a needle, you should know what are all the structures it is going to pierce, right from the skin till you reach the pleural cavity. So that is anatomy comes here. Same way here you can see various points. If you actually put your stethoscope, you can auscultate so many sounds, and most commonly this is the apex beat. So only if you know you have a thorough knowledge where you are supposed to put your steth to hear the apex beat, and that is called as clinical anatomy. For all the procedures, whether it is appendicitis or whether it is hysterectomy and so on. For everything, when you apply your anatomy in a clinical setting, that is called as clinical anatomy or applied anatomy. Okay. Now, of course, we are dealing with the medical sciences, and the basics of medical sciences is anatomy, physiology, and biochemistry. So these three subjects are actually called as the preclinical subjects, and they also called as the basic medical sciences. So every art, or for that matter science, has its own language. Same way, medicine also has a language. Why it has a language is because only if this language is followed, then universally it should be accepted. So anywhere you go, if you speak this language, then what happens is people who are in this profession will definitely understand that. So for that, to understand the language of medicine, what we call it as nomenclature. In anatomy, it is actually called as anatomical nomenclature. So in the forthcoming slides, I would be speaking about this basics of this anatomical nomenclatures. So please pay attention to it. First and foremost, if any structure has to be described in any textbook or in any research material or anywhere you come across, what is referred is called as the normal anatomical position. So all the structures described anywhere in the world, if you read anything about anatomy, it is assumed that that particular nerve or artery or muscle or bone is described assuming in this anatomical position. What is actually a normal anatomical position is a person standing erect, upright, with his head, gaze and toes facing to the front, arms hanging by the side with the palms facing front, lower limbs close to each other, and what happens is feet parallel and toes directed towards the front. Okay, so I will repeat. A normal anatomical position is a person standing upright, head, gaze and toes facing front or looking forward, arms hanging by the side and palms facing front, lower limbs close to each other and both feet parallel and toes directed towards the front. This is normal anatomical position. Sometimes some books also refer to another position which is called a supine position. Certain structures are actually described with keeping this position in mind, that is a supine position, is the position where lying with the face directed upwards and your back resting onto a surface. This is actually called as the supine position. The opposite of supine position, what you see here, is the prone position, which is your back is facing upwards, whereas the anterior aspect of your body is actually touching the surface or head looking downwards. So prone position is exactly the opposite of supine position. There are other positions which I would like to pass away very quickly. The next is lithotomy position, which you see here is actually the patient lying supine position only, legs apart. You are able to see here both the hip and the knee flexed. Now this position is mainly used for some surgical procedures, investigative, and in women it is mainly used during delivery. Then there is also one more position which you should come to know, is the recumbent position, which is to the right side or left side. So lying to one side is actually called as the right lateral recumbent position and left lateral recumbent position. Now this position is mainly persons with some lung disease, to give rest to the diseased lung. So they are advised to actually lie in this position, or sometimes to drain certain fluid from the pleural cavity also. This position is recommended by the clinicians. Okay, fine. So far we have seen the normal anatomical position, supine and prone position, lithotomy position and recumbent position. Next, we will discuss about the planes of the body. Now the first and foremost what you see here is the sagittal plane. The sagittal plane is actually a vertical plane which runs from top to bottom, and when it runs in the exact middle or midline of the body is actually called as the mid-sagittal plane. So a mid-sagittal plane runs directly down the midline of the body and it divides your body into two equal halves. Okay, so naturally we humans exhibit a bilateral symmetry. Okay, there are other types of symmetry also which we call it as a radial symmetry. An example of radial symmetry is starfish. So if you cut across in radial directions, then naturally what you get into equal parts. But here we exhibit bilateral symmetry, and only in the mid-sagittal plane our human body can be divided into two equal parts. This is the only plane where we get two equal parts of the body. Now any plane which runs in the same direction but passes parallel to this mid-sagittal plane is actually called as the parasagittal plane. Okay, parasagittal plane. The next plane is actually called as the coronal plane. The other name for the coronal plane is actually the frontal plane. So it is exactly perpendicular or at right angles to the mid-sagittal plane, and it actually divides your body into an anterior half and posterior half. But remember, anterior and posterior are not equal halves, they are asymmetrical. Okay, so that is the coronal plane for you, which divides your body into your anterior and posterior half. It is actually right angles to the median plane. The next plane is the transverse plane or the horizontal plane. So it rises horizontally or transversely and at right angles to both the median as well as the coronal or the frontal plane. So this is the transverse plane. So any cross sections you see, they are actually at this transverse plane, and if you divide it in the middle, it can divide into two halves, into an upper half and lower half, and again both the upper half and lower half will not be equal. Again this is only asymmetrical. So we have seen about the mid-sagittal plane, parasagittal plane, coronal plane, transverse plane. There is one more plane which is actually called as the oblique plane. The oblique plane can simply be described as the odd plane because it does not run horizontally or else vertically. It just runs obliquely. So that is why it is actually called as the oblique plane. So this plane is also required to actually mainly in our radiographs. Sometimes what happens is we actually need to view certain structures in this oblique plane because if you don't get a clear picture of it. So next two planes, we are going to come to the terms which are actually called as the anatomical terms. Now these anatomical terms are very important. Only if you know these terms and only if you are well versed with these terms, you will understand anatomy. So any book you read, these terms will be used very frequently because all the structures, whether it is an artery or nerve or bone or ligament, joint, muscle, all are described with the help of these terms. Okay, so we will see the terms one by one. So first term is the anterior. So anterior means towards the front, and synonymously you can use it ventral. Ventral or anterior, which explains that structure is lying more nearer to the front. The opposite of anterior is posterior or dorsal. Usually ventral or dorsal is used in quadrupeds, but for the sake of convenience, these terms are interchangeable. Anterior or ventral, posterior or dorsal is towards the back. Then what you have is the superior. Superior, or it is also called as cranial, when a structure is more nearer to the head. Inferior is actually caudal, that is when the structure is more nearer or towards the feet. Now these are all terms of comparison, especially for relations. For example, structure A is anterior to structure B, or structure X is superior to structure Y, so and so on. It is used to describe mainly the relations. Next, when a structure is exactly in the midline, it is actually called as median. For example, your sternum is exactly in the midline. Your chin is actually in the midline. Now, other structures, when we refer to a structure as medial, then that means it is nearer to the midline. So medial means it is more or nearer to the midline, and the opposite of medial is actually lateral, which means it is away from the midline. So we have seen about anterior, posterior, superior or cephalic, inferior or caudal. Then we have seen about medial, which is nearer to midline, and lateral, which is away or farther from the midline. The other terms which we commonly or more frequently come across in anatomy is bilateral, that means which is present on both the sides, on either sides, right side and left side. For example, your kidneys are bilateral, your lungs are bilateral. Okay. Next is when it's present only on the one side, which does just an unpaired structure or does not have a counterpart, is actually called as unilateral. So unilateral, example of unilateral structures, of course your heart is present towards the left side of your body, more towards the left side to be exact. Stomach is a unilateral structure because we have only one stomach, which is present again to the left side. Your spleen is a unilateral structure. Your liver is a unilateral structure. They are all unpaired structures which are present unilateral. Ipsilateral and contralateral, these two terms are mainly used to describe the nerves or nerve fibers. When the fibers run on one side of the body only, that is on the same side from where they originate, and they run on the same side without crossing to the opposite side, then it is actually called as ipsilateral. Contralateral is when the structure originates on one side but crosses to the opposite side, then actually it is called as contralateral. Okay. To name some more terms, superficial means closer to surface, that means closer to the skin. It is actually called as superficial. So sometimes we tell, no, so your knowledge is only superficial, you have not gone into the depth. So that's actually used to refer superficial, more to the surface, you have not gone very deep. And naturally opposite of superficial is deep or away from the surface. So in case of anatomy, let us assume that deep means more nearer to the bone. Then proximal and distal, which these terms are mainly used in the description of the structures in the limbs. Again, proximal means above or distal means below. So naturally it is nearer to or away from the head. We call it as proximal and distal. Then, with respect to the organs, especially the hollow viscera, for example, your stomach is a hollow viscera. The uterus is actually a viscera which has a cavity. So more than hollow viscera, if you have a cavity, your viscera, then we call it as interior and exterior, which is inside of that organ and exterior is outside the organ. When there is some projection interiorly, when it projects within, it is actually called as invagination. When something projects outside from the organ, it is actually called as evagination. Okay. So next, we are actually coming to the one more important aspect with respect to this anatomical terms is the movements. So these movements are very, very important because these movements describe the action of muscles, the action of various joints. Okay. The first and foremost movement which I am going to describe here is the flexion. So what is flexion? So flexion is the bending forward or decrease in angle. So here, for the sake of demonstration, you are able to see the flexion of elbow. So when the forearm is brought nearer to the arm, so naturally what happens is the angle actually decreases in the region of the elbow. So flexion is actually bending forward. So when you bend forward is actually called as flexion. Only exemption is the knee joint. When you flex the knee means that means your leg actually bends backward. Is that clear with respect to the flexion? So we'll go to the next movement, which is actually called as extension. So extension is definitely the opposite of flexion. So when you have to bend, naturally it has to come again to the normal position or straightening. That is actually called as the extension. So when that part moves posteriorly, when there is actually an increase in the angle, it is called as extension. So here in this illustration, you are able to see the extension of again the same elbow or forearm. And again, one more exemption here is the knee joint. When you extend the knee, that means what happens is your leg moves anteriorly instead of moving posteriorly. So we have seen what is extension, then we have seen what is flexion. Next, abduction and adduction. So what is abduction is moving any part of your body away from the midline is actually called as abduction. So here you are able to see your arm is actually moving away from your body. That is actually called as the abduction. So if somebody kidnaps somebody also, we use the term he has been abducted. So that means taking away, and that is why it is actually called as abduction. The second movement is actually adduction. So adduction is actually the opposite of abduction, or what happens is the reverse of abduction, where it is brought nearer towards the midline. So that is actually called as abduction. So now what happens after abduction? The arm is in the adducted position. The next movement is some rotary movements. We call it as medial and lateral rotation. So medial rotation is the inward rotation in which the anterior surface of the limb moves close to the midline. Okay. So what happens is the anterior surface of the limb is rotated in such a way that it moves close to the midline, and the opposite of that is the lateral rotation, when the anterior surface of the limb is taken away from the median plane, is actually called as the lateral rotation. Medial rotation and lateral rotation. Circumduction is a combination. It itself is not a separate movement, but a combination of flexion, extension, abduction, adduction and medial rotation brings about circumduction. So this is mostly possible in your shoulder and hip joint. Mainly these two are ball and socket joint. Next movement, pronation and supination, very specific to your forearm. So in case of pronation, what happens is your forearm rotates in such a way that the palm faces downwards. Okay, that is actually called as pronation, and here you are able to see your forearm is in a semi-flexed position. It is not completely flexed, half flexed, in a semi-flexed position. You are able to see your palm faces downwards, that is pronation. And the opposite of pronation is when the palm faces upwards. Rotation of your forearm in such a way, when the palm is facing upwards, it is actually called as supination. So that is the pronation and supination movement for you. Same way, like pronation and supination is specific to the forearm, you have the inversion and eversion, which is actually specific to the foot. Inversion is a movement in which the medial border of the foot is raised so that the sole of the foot faces inwards. This is actually the inversion. The opposite of it is when the lateral border of the foot is raised in such a way that the sole of the foot is facing outwards, is actually called as inversion and eversion. So inversion, when the sole of the foot faces inwards, and eversion is when the sole of the foot faces outwards. Then what you have is the elevation and depression. So this can be best demonstrated with your jaw movements, especially your lower jaw, the mandibular movements. So during elevation, the lower jaw moves superiorly, and very simply you can tell when you close your mouth, it is an elevation movement which is taking place. Depression is when you open the mouth, especially during eating or speaking. So naturally, this is actually the depression movement which occurs during the opening of the mouth. This is elevation and depression. So in movements, we have seen about flexion, extension, adduction, abduction, medial rotation, lateral rotation, inversion, eversion, elevation and depression. There are also other movements which I will be discussing in the respective classes, like what we have, we call it as plantar flexion and dorsiflexion. We have hyperextension. Okay, so all those movements which will be described later in the forthcoming classes. Okay. So ultimately, coming to the our end of the class, how actually the structures are arranged inside our body. We all know that in the depth what we have is the bones which forms the framework. Then surrounding these bones are the muscles. They anchor to these bones and bring about the movements. So bones, intimately related to the bones are the muscles. Running between these muscles are blood vessels and nerves which forms the neurovascular bundles running in between the muscles. Then apart from that, you also have these vital organs like the lungs, heart, brain and all your reproductive organs, digestive organs, excretory organs are all present. So these bones, muscles, neurovascular structures and all these organs are again covered by what we call it as the deep fascia, and on top of deep fascia which we have superficial fascia, and above the superficial fascia it is covered by the skin. So right from the skin to the bone, these structures we will encounter in the dissection or when we read anatomy. So in this lecture I have summarized to you what is the definition of anatomy, then what are the various positions, normal anatomical position and various other positions, then planes of the body, then basic anatomical terms, then movements of the body. Thank you very much for listening to this lecture.